Hey, Section 3, what looks like we're off to a good start. Here's your Week 1 wrap-up. So first of all, let's get to our shout-outs. Alpha, and Alpha, Gabe, you did a great job of supporting your original post with some evidence and then bringing some more evidence into the discussion as we dialogued back and forth there. Also, Catherine, you did a good job in Delta with some discussion there, bringing in some good points and good self-reflection. So for Week 1, we talked about some big picture with our practice guidelines. A lot of you brought up treatment-based classifications. We had some discussion on red flag screening. That was pretty good. So we need to think about each of these pieces as we go through the rest of our course: examination, evaluation, diagnosis, prognosis, and then intervention. A lot of times we get stuck on our interventions and we want to improve our manual skills. But the rest of these pieces are very important and can make the difference between a good clinician and a great clinician. So just think about each of these pieces when we go through the rest of the course. So professionalism, we also talked about, some communication with our colleagues and our referral sources came up in some discussions. Memberships to our organizations that help support us and advocate for us, and involvement in those organizations as well. And if just getting out there and advocating and talking to your legislators is just not for you, then be sure to support that with your monetary donations. We also were talking about evidence-based practice questions that you have. I didn't see too many questions I didn't really see any questions about things that you didn't understand about evidence-based practice. We'll see if we end up having some questions as we work through some of the things, but I'm glad to know that most of you have a good handle on the readings that we had for this week. So also has come up, what are good posts? So I've attached a Word document. I will attach it to this announcement that just has some good helpful hints on what are good posts and then a good example of a good post. Needs to be supported with your literature and, some critical analysis of those articles that you're putting up. What makes it a good article? And that's in some of this housekeeping. That's the third part here. Include literature when possible and speak to the quality of that literature. Make sure that you're getting your responses in as early as you can. They're due by Saturday at noon, but that's really our minimum requirement. So we really need to be getting these in, if you can, earlier so that we can have time to discuss back and forth, because by the end of Saturday, I'm really looking towards the next week. But do come back, Saturday evening or Sunday morning if that's available to you, and make sure that you're wrapping up these discussions and that things don't just leave open-ended, and make sure that you got yourself got the questions answered. Okay, so and don't leave questions unanswered on your own posts. So if somebody took the time to respond to you, make sure that you answer their questions or comments there. So for Week 2, we are into examination, our treatment-based classifications, outcome measures, prognosis. And you guys have a really good lineup for this. We've got evidence-based exam by Dr. Flynn, outcome measures by Dr. Weiner, TBC by Dr. Paul Menken, and then some psychologically informed practice by Dr. Steve George. That's great. And then some treatment for that in that same line with Dr. Tim Flynn again. So our fellows cases are due by Friday at noon. I could be wrong about that deadline, but we'll just keep it Friday at noon unless it's in the syllabus for after that, and then we'll take that one. Discussion for that will continue until Week 4. And if you're not in the fellowship, feel free to stop by and read some of those cases and get some advanced clinical reasoning there. So that's the end of the wrap up. I'll see you guys back on the boards.